Jan Ruma, welcome to More Health, Less Healthcare. And I want to just start off by way of introduction. The Pathways Community Health Hub Institute really made a significant contribution to the Health Equity Case Studies Handbook. Methodologies, metrics, loads of information, and especially results. So my appreciation really sharing so many incredibly valuable learnings. I think that the readership's going to get a lot out of it. So with that intro, how did you get involved in PCHI and when did this all start?
Sure. Well, I think that the same things that interest you in the PCHI model definitely interest me. And 20 years ago, I was serving as the vice president of a regional hospital association in the Toledo, Ohio area. And the local foundation brought Dr. Mark and Dr. Sarah Redding in to share the PCHI model. I, at that point, was responsible for community health improvement efforts, and we immediately wanted to implement a Pathways Community Hub as a result of learning about it. And that's exactly what we did. Really were able to see, and compared to other initiatives I've been involved with, nothing is quite like it as far as a way for communities to work together, solve problems, and improve health of those who often do not get the health care and community resources that they need. So we became the first certified Pathways Community Hub in the state of Ohio, and I've been involved ever since.
How long ago was that?
2005 was
Oh,
when I first learned about the model, and we began implementing right away and had community health workers out in the field by 2007.
well, I got to say, at first glance, the model looks a little complicated. So can you walk us through what does the model set out to do? In simple terms, what does it set out to do?
Really, it is set out to boil down a very complex health and social system that we have into making sure it's accessible for those who need it the most by providing a community health worker to help identify risk factors that can be addressed and then work to address them one by one. So in simple terms, the model is designed to find those at greatest risk for poor health outcomes, engage them in their care, and connect them to community and healthcare resources, and measure the results and work to close any gaps that exist as a result.
Well, we'll definitely get back to risk factors in just a minute, but you talk about, throughout the case study, you have a holistic approach to care. What does that mean, and especially in relation to families?
Sure. So the PCHI model was really built on whole person care. The idea that, you can't just address the, eye health or teeth health or heart health, but you have to look at the whole person. And that includes non-medical drivers of health. So thinking about housing and transportation, employment, social service needs, hard good needs, and then making sure people understand their health and how to improve it and how to protect it. So it's really looking at the whole person from that individual's perspective and what's important to them, not necessarily what's important to the system, but what is going to make that individual most healthy.
All right, so let's talk about what's important to them. How do your families know that they're getting better care now? What kind of measures do you track? What kind of stuff do you work with them?
So for the families, the way a Pathways Community Hub knows if they're engaged in the support they're receiving from the Pathways Community Hub is that they stay engaged, so that it isn't a one and done relationship. It's an ongoing relationship. Individuals are enrolled, ideally for 3 to 12 months or longer until all their risk factors are addressed. And Pathways Community Hubs do satisfaction surveys, do focus groups, do get feedback through their CHWs and directly from the individuals enrolled of are their needs getting met?
Well, let's talk about risk factors, and that gets us right into the payers. And my sense is that, payers like managed care, Medicaid managed care, my sense that payers like Medicaid managed care plans and Medicare really need to know a lot about what risk factors in order to underwrite, policy for beneficiaries. And most beneficiaries come with, multiple risk factors. So when underwriters need an accurate risk profile, especially if payment is going to be tied to outcomes, right? So without outcomes-based payment, we're still going to be stuck with the current cascade of episodic events, which are expensive and preventable. So for me, the conclusion is pretty stark. Without a different form of payment, we're not going to get different result, period. So what's your sense of what do your payers want? What's their expectation? What's your experience working with them? Whether it be on the Medicare side or on Medicaid side.
Right. Pathways Community Hubs often contract with both Medicaid and Medicare payers. And really, they're looking for the community to be an extension of their mission and address those, health-related social needs that really drive their ability to get their health needs met. So they're, they have contracts with, clinics and hospitals and providers, but they don't have a mechanism in which to connect people to housing resources, food, basic needs. And so they are looking to the Pathways Community Hub to complete that whole person care circle and address those non-medical needs while also doing it in a way that connects the individuals to the healthcare that they need so that they can, ultimately they're looking to validate that they're providing quality care based on HEDIS measures and other quality measures. And the PCHI model is really aligned to create that stability so that that care that results in quality care can happen.
I mean, do the health plans understand this concept of whole person care?
Oh, I think that, certainly it's a buzzword, but, we work with many plans who totally understand the importance of looking holistically at their members' lives and the barriers that prevent them from getting the care and they're really looking to make sure they're providing preventive care to reduce high cost care. And it is in meeting those basic needs that is the foundation that leads to the screening, that leads to the detection that, prevents those emergency visits.
Okay, let's go back to paying for outcomes again. How many pathways are there? I can only imagine. How many pathways are there, and why do you have so many?
So, well, there are 21 standard pathways, and they measure hundreds of different connections. A Pathways Community Hub is really doing community-based care coordination, coordinating everything before someone gets to that clinic door or getting someone to that clinic door. And so the pathways are tracking individually modifiable risk factors. So risk factors you can do something about if you have education about that risk factor and ways to address it, and if you get connected to the resources that you need. So a community health worker is utilizing those 21 standard pathways to identify risk and track their work with the participant to address that risk. And when that risk is addressed, that is an key outcome that then payers are asked to pay at that point.
Give a couple of examples of pathways and how you track the progress of a certain pathway. And does the tracking process differ from one pathway to another? Because there are probably multiple pathways all at the same time.
So exactly, an individual, I think on average enrolled in a Pathways Community Hub has 6 or 7 pathways open at a time. And it's just a matter of priority and access to resources that help dictate the order in which they're worked on, and sometimes multiple ones up at the same time. But the pathway structure is pretty similar. It's one, the identification of the risk. So let's talk about housing. If someone says, you know, I just got evicted from my apartment, the CHW is going to think, oh, we may need to open a housing pathway. You know, why is housing an issue? They document that. And then their first thing, they need to know what the community resources are and connect that individual to the ones that are applicable to them. And the goal of the community health worker is to get that individual connected to that housing resource. And maybe the long-term goal, a completed housing pathway, is when someone has been safely housed after being unhoused for at least 30 days. But there may be an immediacy, an urgency to say, we're going to get you into shelter. And that would be an intermediary outcome in the housing pathway that, you know, we secured short-term housing for 7 days while we continue to work through the process to get long-term housing. And then it's just a matter of through the pathway, and this is the same for all pathways, documenting the steps taken to mitigate the risk. And then once the housing is secured, making sure that it's not just, oh, you're housed for 1 day, managed care plan, pay for that, but making sure that's a sustainable solution and that housing is in place for at least 30 days, and that completes that pathway.
Give me another example that probably everybody can relate to. What's a pathway for maternal care and for newborn care? And how do you basically package both?
Yeah, so pregnancy is its own pathway in the PCHI model, and it starts with confirmation that there is a pregnancy, works through each prenatal visit, and the role the community health worker plays in making sure that visit happens, whether it is in arranging for childcare for other children, you know, working through their plan to make sure they secure transportation, that they have the appointment. And then once you get through all the postpartum visits, the end result to have a successfully completed pregnancy pathway is a healthy birth weight baby. And once that pregnancy pathway is completed, then there's the postpartum pathway to make sure that that mom gets to their postpartum visit. And then when it comes to the newborn, while they don't have their own pathway, they use the other pathways to get through the first year of life and beyond. And what you do with a newborn is the same, you know, with an adult who may be trying to manage chronic disease. It's just the type of providers they need to get to are differently, or the type of immunizations. But, you know, with a newborn baby, you want to make sure you have a medical home, that you have immunizations, that you do a developmental referral to make sure they're growing as they should. And getting to, you know, if there is any medical issues, making sure they get to any medical referrals that they need. That's a pathway unto itself. That a medical referral pathway could be for a medical test or a specialist. So the nice thing about the 21 standard pathways, while there's some that are specific for, let's say, the pregnant population, most of the pathways work for all populations, so they can be used for the whole family. So it's important that the whole family is connected to the care they need, and each family member may need different care.
All right, let's talk about your engagement fee. What's it based on? And does it have a relationship to how many pathways are being worked on?
So the engagement fee is something that is earned each month. Each member has a home visit with their CHW. So it really is measuring the relationship between the individual and the community health worker. That without a strong relationship and a trusting relationship, it's going to be impossible to work on any of the pathways. So it is really the process that's necessary in order to address the risk factors. So so there's a payment negotiated for engagement, and then there's a payment negotiated for completing each pathway, not opening them, but actually solving those problems. And the basis for the payment is what PCHI calls outcome-based units.
Right.
Each pathway has an outcome-based unit based on the complexity and importance of that pathway. The engagement fee can be based on outcome-based units as well. And we really base the risk of the participants based on how many outcome-based units there are in all of their open pathways. And that helps to understand the complexity, health and social of the individuals enrolled.
Well, I can't help but think that code creep is so widespread in the industry. Is there any incentive to take on too much, to do more and more and more? Is there any built-in mechanism that just focuses on what's the appropriate number of pathways to pursue?
It is really based on the individual and what their situation is. Oftentimes we see payers who say, well, we're really interested in housing people, so we just want to pay for housing pathways. But the reality is, if you just focus on housing, but mental health is the underlying issue and they're not getting to their treatment, that housing solution, if you get to one, is not going to last. So it is really individual based, and each pathway to get paid for it, you have to document that you've completed it. So I think there are some kind of built-in controls to make sure you just don't, open every pathway for every person. I've never seen one person, thankfully, with all 21 pathways open, because you don't get paid for opening them. You get paid for solving problems.
I just want to make sure. Okay.
Yeah.
It seems that community health workers are the absolute key. And here's my belief on community health workers, that community health workers are really the essential key, one of the main building blocks of any kind of model of community-based care. Yet, most people don't think about CHWs. We talk about nurses, doctors, pharmacies, hospitals, but not so much community health workers. And in terms of community health, CHWs are actually more important than physicians and hospitals. And it goes without saying that their pay scale is a fraction of the cost. So I think investing in CHWs, if for no other reason, just to close care gaps, but then also, to take that next step to make the appropriate referrals to whatever acute care facility or program may be necessary. But CHWs are really the frontline workers keeping families healthy and safe. What's your sense of the importance of CHWs to your whole model? Are they the essential building block?
Absolutely. PCHI couldn't agree more with the fact that CHWs are central to connecting the dots for people to get the care and support that they need. And the model was actually designed by the Reddings to support the community health worker workforce that traditionally has been funded through history, through grants and donations, but hasn't really been embraced by healthcare payment. And this model, with its outcome philosophy long before value-based payment was talked about, was designed to say, you're getting value for this, and our data can show you the value you're getting, and it wouldn't happen without the work of CHWs. But CHWs are part of a team. They can't operate in a vacuum. They need that connection to clinical expertise and clinical services. They need the support of the hub structure to make sure the training and the billing and all of those pieces happen. We really need to function in a team-based way, and really look to community health workers as being a key part of that team.
I don't have to sell me on it.
Yeah.
So you have a very standardized, structured methodology, and the CHW is obviously at the heart of it. What's the need of a structured data system at the same time, both your standardization and structured data, how do the two go hand in hand?
Well, they really do go hand in hand, that the structure of the model is supported by a complete data system with data points for, each pathway. There's several sources of completion. And so they're codified within the data model. So it is a drop-down list that people are picking from, but yet communities are unique and may have unique resources beyond that. So each Pathways Community Hub can, further that drop-down list under the PCHI heading with those local resources. So you can really track how risks are being addressed, who's addressing them, and then that allows you to kind of go back and talk to the people who are solving these problems for people and figure out how can we build capacity to solve more.
Okay, so you mentioned a community hub. What's a community hub and how do you work with it? Why is that so essential too?
So I think we've seen over the last couple of years the idea of a community care hub kind of raise above the surface, and the PCHI model has designed the Pathways Community Hub as a specific type of community care hub that coordinates a geographic area, usually a county or a region, to create a system of care for people who need it the most. So pulling together all the nonprofit organizations, the resources for people, and the Pathways Community Hub is working to secure resources for other community-based organizations to hire CHWs to work through the PCHI model to connect people to care and the community resources that they need. So it's really a way to break down silos in a community, to organize, and then also to collect data from multiple social service organizations that are all helping people using the same methodology, the PCHI model, and seeing where there's gaps and where there's successes, and working to fill those gaps by, fund development, by partnership development, by advocacy. So really a Pathways Community Hub is a way to solve problems in a community.
I think in the case study, there are three different segments, and there's a mature organization, one that's been in business for a while, the one that's just starting out. And I think it's somewhere between 1, 2, and 3 years. How long does it take to implement a hub?
So it does depend, but I would say, usually it takes a year to raise the resources to get started, to put together a network and to provide the training. But if you start and you don't have the resources, you may need to add a year to that. So,
Yeah.
I mean, I think that if you have the resources in place, you can get started in 3 months, but usually it's about a year to get started. And then you just, as your resources grow and as you learn from your implementation, you expand your capacity and are able to serve more people in your community.
All right, let's talk about money.
Okay.
Let's say as you go through this developmental process, there are benchmarks along the way, and try to have recurring revenue, I guess, is the name of the game. How much money are we talking? We're talking about $500,000, $1 million for a community that wants to move, and it really has at least some of the leadership pieces in place. What kind of budget should they be looking at? What should they be aware of as a funding, at least as a funding platform?
Sure. So the bigger the impact you want to have, the more community-based organizations you need to employ community health workers. So that is really your limiting factor of how many people you can serve, how many CHWs you have. But you also need that hub staff, you need the data system, you need those operating costs. And we advise communities to look, when you initially start, to an around number, try to have at least $500,000 a year for your first couple of years, and try to secure that venture capital, that startup funding, so that you can operate for 2 or 3 years while you're building your case through your own data to say, we're able to achieve the same outcomes that others have achieved, and we can do this for your members, and then work, through the whole process to involve payers in the startup, and then transition from grant funding to demonstrate outcomes to contracts with payers. And then the payer contracts usually pay for the cost of the care coordination, and the Pathways Community Hub needs to raise funds from other sources to help support operations and also support solutions. That the whole model is outcome driven, and everyone is focused on solving problems for people. And so as you see problems and develop solutions, you need resources to keep those solutions in place for the next person enrolled. So it is really a way, as I said, to close gaps in your community, solve problems, and create healthier lives and more stable families.
So when a payer is looking to partner with a hub, are there one or two things that, whether it be leadership, capital stock, whatever, what's the payer need to know about that hub in order to have the confidence to go the distance with them? It's a long-term relationship. What are they looking for? What one or two things really stand out?
So I think they're really looking for the Pathways Community Hub to have knowledge of the community, the resources exist, and how to get people what they need. On top of that, they're a healthcare provider, and so they need to make sure that, HIPAA is going to be followed, that there's policies and procedures, that there's a data system that's going to protect their members' data, that they can get the reports that they need. And at the end of the day, I think it's that what their members need beyond the clinical care that their provider network provides, that the Pathways Community Hub is able to really leverage meeting those needs.
Well, so maybe most important final question is, what level of savings are possible using your model? What kind of ROI do you basically promise? Or what level of ROI do you strive for?
Right. Well, I think that the bottom line that we've seen in the studies that have been done is individuals who are enrolled in a Pathways Community Hub and actively working with their CHW have improved health at a lower cost than community members with the same demographics who do not. So we have seen that difference be those not enrolled are more than 1.5 times likely to need higher level care, to have worse outcomes. So there is really that return on investment, and plans have done studies to show that for every dollar they invest, they save over, close to $2.50. So there really is a return, and that's just in the short term. If you create stability in someone's life, that return continues beyond when they're enrolled in the hub, because they have learned how to get connected to things that they need from their CHWs and are able to do it for themselves.
Yeah, it's a lifetime investment.
It is.
Well, let me end with, what gives you optimism about improving health going forward?
So I just think the power of community is really harnessed through a Pathways Community Hub. And I think that, communities are amazing places that, given the right tools and having the right partnerships, can really make that difference. And this model really creates that power in a community to make the difference and improve its lives.
Well, Jan, thank you much for not just your optimism, but your optimism and all the methodologies that really bring a lot of terrific care to your families every day. That's huge. So thank you again.
Thank you.
Much appreciated.
Thanks for bringing it to light.